Hello and welcome. My name is Emily Dauberstein. I am a stage 2 Hodgkin's lymphoma survivor, and I went through 4 months of chemotherapy, and I've been in remission since August of 2021. Today, as a fellow cancer survivor, I'm here to talk to you about the impacts of cancer on sexuality for both patients and partners. We're going to talk about both the need for more conversations, and we're also going to take some time to debunk some sex myths with some additional practical tips for navigating some complications that can come up during cancer treatment and post-cancer treatment. So for patients, 20 to 90% of us will experience some sort of sexual dysfunction during or post-cancer treatment, but only 17 to 25% of us will have our doctor actually talk about it with us. There is also age, gender, and marital status bias that happens in the frequency and of talking about sex with patients, but then also in how sex is talked about. But there are ample needs all around for more conversations around sexuality in the cancer community. Another part of this conversation that often goes overlooked is the impact on partners. Partners of cancer patients report that they want more information. 71% felt they wanted that information presented systematically, and over half wanted or thought that a healthcare professional should be the one to deliver that information. Sometimes people are immediately referred to sex therapists, which can be helpful, but when you already have so many clinicians on your team, that can feel really overwhelming to add another appointment to your very long and complicated schedule of appointments. Overall, the most desired information is just generally practical advice and other people's experience, what they've been through, what they've tried, what helps. So hopefully I can provide some of that for you today. So now, debunking some sex myths, and these are things that can get in the way of sexual connection during and post-cancer treatment, and we're also going to talk about how to work around them. So number 1, all sex leads to orgasm. This is not true. It is totally possible to have fulfilling and quality sex without the presence of an orgasm. Just if this is the case, your definitions of sex may need to broaden and stretch a little bit. Before we talk about tips, I want to emphasize that not being able to orgasm says nothing about your partner, yours or your partner's worth. It says nothing about the quality of your relationship or your validity as a lover. It is totally fine if orgasm is hard, either during sex, after sex, during cancer treatment, after cancer treatment, before cancer treatment, regardless of when it happens, there's no shame. If it is hard, you can still foster intimacy by changing your expectations during sex. This helps resist what we call the spectator role or spectator mode, where you're so in your head that you can't even feel what's going on in your body. You can take the pressure away. Sex therapists sometimes prescribe what's called sensate focus, and I don't have enough time to go fully into detail about that today, but the whole idea is just kind of taking this pressure away, engaging in forms of physical touch without the expectation that orgasm needs to happen, and there are still ways to foster that intimacy. Number 2, sex has to involve penetration. So this is very biased in a heteronormative way. Regardless of whether cancer is involved, penetration is one way to have sex, but there are so many other ways to have sex and to foster sexual intimacy outside of penetration alone. And going through cancer treatment for male-bodied people, penetration may be hard or impossible because of erectile dysfunction. For female-bodied people, it might be hard or impossible because of pain or vaginal dryness. Lubrication can be almost impossible for some people during cancer treatment, at least naturally. And sometimes focusing only on penetration needing to happen during sex can cause a lot of anxiety and shame, which we don't want. Tips to combat this: lube, some good brands for sensitive skin, which can really happen during cancer treatment. There's more discomfort and some sensitivity in the genital area. Good Love is a good brand, as well as Liquid and Uber Lube. You can also engage in non-penetrative sex, things like oral, anal, manual stimulation, as well as using sex toys like vibrators. Number 3, there's no way to have good sex without a condom. With enough lube, condoms can be totally pleasurable. And also during cancer treatment, they are imperative. They prevent pregnancy, which we especially want during cancer treatment because sperm affected by chemo can cause birth defects, and if a female-bodied person gets pregnant, it's likely that pregnancy would have to be terminated during treatment. Also, sperm and vaginal secretions can contain toxic chemotherapy for 5 to 7 days after each infusion, and so you're going to want to use a condom in order to protect your partner from being exposed to that chemo unnecessarily. So a huge question that I had was, is oral okay? So if chemo is in secretions and someone's putting their mouth in that area, what's that impact? And my doctor said, oh, interesting, no one has ever asked that before, which just shows like how little conversation happens in the cancer community around sexuality. Even though we are all sexual beings and we do not stop being sexual beings, sex does not stop being important while we go through cancer treatment. So the answer is yes, but you're going to want to use a condom or a dental dam for female-bodied people, which is shown over here, for the first 5 to 7 days to kind of inhibit that unnecessary exposure for your partner. So number 4, some positions are superior than others. Not true, though you may have to ditch some of your normal acrobatics and go to some more kind of basic sex positions in order to kind of modify for fatigue or pain, but that does not mean that those positions, because they're more basic, that they are less superior than other kind of more advanced sex positions. You can have totally amazing sex with these positions. They involve kind of putting the more fatigued person in more passive roles where they don't have to exert so much. You can also have the more nauseous person kind of be the one on top where they can have more control. And a huge tip is to not change sexual positions during sex, kind of get comfortable and stay there, because moving around really abruptly can kind of re-trigger that nausea for someone who has recently gone through chemo. And also, if sex is too much and your nausea is too bad or your pain or fatigue is too bad, that's okay. And partners prepare for times when your partner is thinking they have enough energy for sex, and you might try petting for a while. Your partner's allowed to change your mind. Say, hey babe, I'm actually just really not feeling this. I don't feel very well. That says nothing about your relationship. Make sure both of you still use really affirming language. Hey babe, I love you, I care about you, I have no expectations, I'm not mad, it's okay. That can kind of make that normalized and make it positive. So finally, number 5, the only good sex is spontaneous sex. You may have to plan intentional time for intimacy during cancer treatment, and I wish someone would have just said that was normal to me. I think I got really frustrated because spontaneity was really hard. I never knew what my body was going to be like. You never know what you're going to get each day. And sometimes just setting aside time for intimacy, whatever you can tolerate that day, whether that's just laying next to each other, whether that's petting, whether that's taking a bath together, massage, candles, putting lotion on each other. I had really dry skin during chemo, so having my partner put lotion on my legs or something like that was just a way to add some quality, intimate, physical touch to our relationship, even when sex was not possible. And if things lead to sex, then that's great, but just remember that taking away that expectation for sex is super important in order to make those times quality and intentional, and to be fully in your body in those experiences for both partners, or all partners. So overall, communication is key, normalizing a positive environment for reciprocal feedback, changing your expectations, changing your definitions of what sex is, and celebrating yours or your partner's body for what it can do or feel, instead of shaming it or blaming it for what it cannot do or feel during this season. So best of luck to you on your cancer journey. I hope this was helpful in some way. Hope you feel some solidarity. You're not alone. Your body is good. Your body is beautiful. Your body is fighting. And yeah, I wish that this information could be available for everyone going through cancer. Please share it. Thank you so much for joining.